Welcome. My name is Rachel Simmons. I'm a clinical psychologist at Lifespan Physician Group and a clinical assistant professor, psychiatry and human behavior at Brown's Medical School. And I will be speaking to you today about body dysmorphic disorder. Okay. So to give you an overview of what we'll be talking about today, I'll explain a little bit about what is body dysmorphic disorder, how do we define it, and how do we diagnose it, what causes body dysmorphic disorder, or BDD, which treatments work, and how can family and friends help. And lastly, I'll tell you a little bit about resources that are available to people with BDD and their family members. So I'm giving this a talk as a part of the Rhode Island OCD organization, and that's because body dysmorphic disorder is actually a part of a group of conditions called obsessive-compulsive and related disorders that are all grouped together in the Diagnostic and Statistical Manual of Mental Disorders. So BDD is categorized along with other conditions like OCD, hoarding disorder, trichotillomania, and excoriation. And that's because BDD shares some features that are in common with these other disorders. There's some similarities in how these conditions present, also in the types of treatments that are helpful to them, as well as some like shared genetic factors. So there's a lot of, there's some features that are common to all of these conditions. And that's why we're talking about BDD today. So what is body dysmorphic disorder? So this is a psychiatric condition that's defined by a preoccupation with perceived flaws in appearance, such as skin, nose, hair, symmetry, or other aspects of appearance. And by preoccupation, we mean that a person is thinking about these areas of their body, often for hours a day, feeling that they're not right, feeling that they're unattractive, disgusting, ugly, shameful, thinking about how to get through the day, how to hide these areas, about what it means for their life. There's just a lot of repetitive thoughts. And this is where BDD, somewhat similar to OCD. OCD, we have those obsessions, those intrusive repetitive thoughts. In BDD, we have these repetitive sort of preoccupations. So there's this component of those repetitive thoughts. And a key word here as well is the word perceived flaws in appearance. So a person is concerned about a flaw that that they perceive, but it's not necessarily something that other people would see or notice. So it's really more in the mind of the person with BDD. Okay. The other key part of body dysmorphic disorder is the compulsive behaviors. So this kind of corresponds to compulsions in OCD disorder. So here we have people feel that they must check the perceived flaw, they have to hide it, they have to improve it. So they might be spending a lot of time looking at it, comparing themselves to others, camouflaging, or researching ways to change it, shopping, things like that. And what goes along with these preoccupations and this compulsive behavior is a great deal of distress and interference with daily life. So one thing that's really important to keep in mind is that body dysmorphic disorder is not the same thing as vanity. Often people feel that they're hard on themselves, saying, "I'm being so vain." But this is not a condition where people are trying to, look their best all the time. It's one in which people feel like really fundamentally not okay in their body, not okay in public, not okay with how they look, and really don't feel safe in their appearance. So it's driven more by those feelings of not right, ugliness, than it is wanting to be beautiful per se. So that's one thing that's key to keep in mind. And the other thing that people sometimes get a little bit confused about is that BDD is also not the same thing as just our ordinary everyday appearance concerns. We all have things we don't like about our appearance, but most of us are blessed to not be thinking about those things constantly and looking at them and picturing them and checking them and so on. So this goes well beyond that, those types of concerns. And to really kind of capture that, when we're talking about distress and interference, capture kind of what that looks like. We can look at some of the studies, some of the research showing us about the levels of functional impairment that people with BDD have. So if we look at lifetime rates of suicidal ideation, 80% of people with BDD are reporting that they've thought of suicide at some point in their life. Psychiatric hospitalization rates are fairly high, 40%. Many people also report that at some point they were housebound to their BDD due to the BDD. So this means they didn't want to go to the store, they didn't want to go to school, they didn't go to work because they were so distressed about how they looked. And not surprisingly, you see like a similar rate of people who are reporting that they dropped out of school for a period of time or permanently or were unemployed because of BDD because it got in the way just that much. So you can see how this goes well beyond kind of ordinary body image dissatisfaction. It's really something people often say they feel tormented about these concerns and really wish they could think about something else instead. So the one thing when we're talking about a differential diagnosis, the one condition that we look to rule out is an eating disorder. There's a lot of commonalities between BDD and eating disorders, and they can co-occur together. But when a person comes in and they have disordered eating, they're restricting, binging, purging, excessive exercise, things like that. When they meet criteria for an eating disorder and their only body image concerns concern their weight and body fat, we would diagnose them with an eating disorder and not BDD. So that's something people get confused about, and sometimes they'll call it eating disorders BDD, but they're not exactly the same. So moving on, let's look at like some of the body areas that people do get pretty concerned about. The number one most common one is skin. Could be acne, could be discoloration, could be blotchiness or scarring. So that's a very common preoccupation that people have. Hair is also a big one. Too little hair, too much hair, hair too curly, too thick, too thin, you name it, just not right. Too much body hair, too little body hair. That's also a major concern. Facial features are also really important, and that's not surprising since people see our faces all the time. So nose is a really big one, but people can also have concerns about teeth and eyes and any aspect of their face. And from there, you can see there's a variety of other concerns. Really, it could be any part of the body. Could also include genitalia. It could include things like feeling overly masculine or overly feminine sometimes. Those sorts of concerns can also appear. And in terms of those repetitive compulsive behaviors, these also, there's a wide variety. You see a lot of different things that come up for people. But the big ones, the most common ones, is look for camouflaging. So camouflaging means that you are maybe putting on makeup, reapplying to cover up the skin imperfections, or wearing a lot of clothes to cover up parts of your body, sunglasses, hats, those sorts of things. So camouflaging, very, very common. Another one's comparing or scrutinizing. I always like to say, if your concern might be your eyebrows, you walk into a room, you might notice everyone's eyebrows. They stand out to you in a way that they wouldn't if you didn't have BDD. So people often are really drawn to those areas that really concern them and trying to compare themselves. Another big place for comparing is social media. That can be really challenging. So that's another one. Mirror checking, checking your reflections. People sometimes spend hours a day in front of a mirror or might check 100 times a day. Just having driven by this uncertainty, like, how do I look? Is it okay? Has it changed? I need to know, those sorts of feelings. Grooming, questioning, skin picking, tanning, you name it. There's a lot of different things that people do. Cosmetic surgery is pretty common as well. And I'll talk a little bit more about that later. So, okay. So if we look at like the prevalence of BDD in the United States, we find about 1 in 50 people meet criteria for BDD at some point. So it's 2% of the population. Slightly more females than males have BDD. Usually the age of onset is those middle school, early high school years. So 13 is the most common age of onset. And there have been studies of BDD in different countries, in Western Europe, Israel, some countries in the Asia. And so far it's looking like there's similar rates of prevalence, similar age of onset and types of symptoms, although symptoms can vary culturally according to like what the beauty ideals are in different places. Okay, so what causes BDD? I wanted to say a little bit about this. People often wonder, and like other psychiatric conditions like OCD, there's not a one single gene or one single mechanism that explains BDD. What we know is it's a complex condition that develops that seems to be related to a number of factors. So one category of those factors are like biological. We know there's a genetic influence on BDD. There's some evidence of brain chemistry abnormalities. And we know that people with BDD respond well to serotonin reuptake inhibitors, suggesting there may be some abnormalities with serotonin or other neurotransmission in the brain. There's also some evidence that what's happening in the brain when people visually process something is different. So we know there have been a lot of really interesting studies about how people with BDD, when they look at a face, they might be zooming in on, again, those eyebrows or lips or particular spots and kind of catching these details without seeing like the overall shape and overall kind of composition of the face. So there's some differences, at those levels. And any of those could be involved with causing BDD or may develop as a part of that process. Social factors, we know that there are a number of social factors that come up when we do studies across cultures and when you do studies of looking at people's life experiences. We see that things like childhood adversity, experiences of bullying, trauma, those things are associated with higher rates of BDD. Other factors like cultural ideals, beauty ideals is important. How much is beauty and appearance emphasized in the culture, and what are the standards? How attainable are they? And as well as the kind of messages that people get from family members and peers and parents. And then psychological factors. So we'll talk a little bit more about this, but what kind of early learning did you have from those social experiences, and how did that shape your belief about yourself, your own worth, about other people, about what's important to them, about how relationships work? Certain traits like rejection sensitivity, perfectionism are also associated with BDD. So what we know is that these are some of the factors that are associated with body dysmorphic disorder, and we believe they interact to lead some people to develop this condition. So here we're kind of pulling this together, all together under an umbrella of cognitive behavioral model. So, we've talked about what is BDD. It's a collection of these preoccupations, these repetitive thoughts, these negative thoughts and images. So you have that feature, a lot of negative feelings about appearance, and then those behaviors, those repetitive behaviors, often a lot of avoidance as well. So that's BDD, and those biopsychosocial factors play a role in developing it. You might ask, well, why does it keep going? Why don't people get better? Why don't they learn from new experiences and kind of get out of that rut? And we believe that one of the reasons that happens, one of the reasons some of the early learning persists, for example, is that some of these symptoms actually feed into one another, and they keep kind of a vicious cycle going. So you're already thinking a lot about your appearance, having some negative thoughts, negative images, makes you feel really awful. Now you feel like you need to check how you look or fix how you look, or maybe you don't go to school. So that changes your behavior. But then those behavior changes actually feed back in. And now you're thinking about your appearance even more. You're even more discouraged. You're thinking even more negatively about yourself. And then more negative feelings, maybe more BDD behaviors. So there's kind of a vicious cycle that can happen. And that's something we really focus on in the cognitive behavioral therapeutic approaches to treating BDD. We really look at trying to change some of what's happening with thoughts and some of what's happening with these behaviors so that we can kind of break that cycle. For those of you who are familiar with cognitive behavioral therapy or exposure and response prevention, you'll probably see some familiar terms here. We use some of those similar types of treatments, such as exposure and response prevention. Mirror training is a little bit different, but we use exposure and response prevention to treat BDD, also challenge thoughts and develop experiments. So those are some of the interventions that are used. Okay, so that's kind of how we understand BDD, like at a high level, like what leads a person to develop it and what keeps the problem going on. People often ask, what is the prognosis for BDD? And we know that BDD is a chronic and relapsing condition. So there are a number of studies out there that have looked at people in the community and looked at what happens over a period of 4 years or 8 years or 10 years, and looks at whether or not the BDD persists. And for many people, it does persist or may go away and come back. So we know that. And while that feels somewhat discouraging, what we also know from some of the research on treatments for BDD is that there are effective treatments that do lead to significant changes in symptoms and can lead to some lasting gains. So let's talk a little bit more about what those treatments are. Okay, so before we get into what works, it's helpful to think about what does not work as well. In terms of, because people are quite concerned with their appearance, quite distressed about how they look, obviously, like the first thing people often think of is getting a cosmetic treatment to help with the BDD. So a person might go to a dermatologist and get skin treatment. They may try a new hair product. They may get electrolysis or may seek out, cool sculpting or Botox or cosmetic surgery. So that's the kind of thing that people often think of first, which makes sense when you really believe the problem is one of appearance and not not more of a psychological condition. So usually that's the first thing that people seek out, but it rarely works. And there have been studies looking at cosmetic surgery in particular, cosmetic treatments in particular, rather, that find that when you survey people and you ask them whether or not the cosmetic intervention helped with their BDD, about 80% of people will say that there's no change. Didn't get better, didn't get worse. It's kind of the same. There's 10% of people who will tell you that actually they feel worse after getting cosmetic treatments. So there's a real danger with getting a cosmetic treatment that you could be in that 10% where now you have a new source of preoccupation and distress. Now you're really obsessed with perhaps the surgery you had that didn't go well, or the results of the laser treatment that you had, or the fillers you got, and now you can be quite preoccupied with that. For, about 1 in 5 people may be happy with a particular change of a cosmetic intervention. And when that happens, it often doesn't translate to improvement in overall BDD, because people will often then just shift their concern, their focus to another concern. So, so all of that makes us as treatment providers very concerned about cosmetic treatments as an intervention for BDD. It's pretty risky and low reward. Okay, so that's what doesn't work. And what does work? Well, there have been a number of medication studies, and this area, actually, this research is still pretty new, so I think there's a lot more work to be done. But what does seem to be emerging at this point is that people with BDD seem to benefit from SSRIs. So these are medications like Lexapro, Prozac, Zoloft. Typically, this is very much like OCD, in the sense that people often will need a higher dose of those medications than you would for treating general anxiety or depression. So studies indicate that most people will benefit from a first or second trial of an SSRI like Lexapro, Prozac. So if you keep at it, usually that'll work. And for some people, of course, other medications, adjunctive treatments are needed. One thing that's important to keep in mind if you or a loved one is ever trying a medication for body dysmorphic disorder is that you need a good 12 to 16 weeks at a therapeutic dose to really see that full effect, that medication. You can often tell earlier that it's starting to have an effect, but you need a longer trial to really see how much benefit you can get from it. So that's important to know if in cases, sometimes people will take a medication, try it for a little while, and then stop taking it, or take a very low dose and will give up on it. But with greater time, a higher dose, it could help more. Okay. And all of that, of course, is dependent upon having side effects that are that are acceptable. Okay. So those are some of the first line treatments for medication. And for therapy, there have been actually a number of studies now. There's always more research being done looking at different types of therapy, and we're starting to find some support for a variety of techniques: supportive therapy, anxiety management, relaxation, even some evidence with that, with anxiety management. But the form of therapy that has been studied the most is called cognitive behavioral therapy. And so there's been a lot of studies at this point looking at different cognitive behavioral therapy packages, looking at different doses of it. And the results are pretty promising. Most people who complete a course of CBT for BDD will improve. And again, those improvements can be quite significant and quite lasting. Some of the newer research coming out in this area also suggests that having a higher dose of cognitive behavioral therapy can be really important for BDD. So there have been some studies of getting 12, patients getting 12 sessions of CBT, and a few studies of patients getting more treatment, 24 sessions. And it seems like that higher doses, 24 sessions, really helps to kind of bring that response rate up. So that's important to know too, if you're interested in doing CBT, or family members interested in doing CBT. It's good to know at the outset that you're committing to, you might be committing to weekly sessions for 6 months to get a really good, robust result. And then from there, often you may, taper, have boosters, you may continue to check in a few times or longer term, depending on what else you're addressing. So that's important to know. Okay. So I want to go back to, talking a little bit more about some of these CBT interventions. Okay. So we talked, so I wanted to say a little bit more about what goes into cognitive behavioral therapy and explain some of these terms that we kind of flew by earlier. So one of the interventions that's used is something called cognitive restructuring, and as well as behavioral experiments. And both of these types of interventions, the idea is to help people challenge existing beliefs and to change those beliefs if they're not accurate. So a person may have a belief, for example, if I go to the mall and I'm not wearing my full face of makeup and my coat, my bulky layers of clothing. If I do that, if I don't do those usual things, then people will laugh at me, and and I'll be humiliated. So that might be a belief that a person has, and that again leads to a lot of anxiety, a lot of distress, leads you to keep those layers of makeup on, those coats on. So you're kind of just stuck in the cycle of I have to do this to be okay. So that cognitive restructuring, behavioral experiments allow you to actually test that out. Is that really true? Or is that like a belief that you've been carrying around that's not serving you? And so what you can do is develop experiments where you go out and you maybe wear a little bit less makeup, or you wear fewer layers, kind of test the waters, see if it goes okay. If it went okay, practice it, get a little more at ease with that, and then maybe try something else. And so it's this type of work, really identifying those thoughts, those predictions that aren't so helpful, challenging them, that really helps people start to make changes and start to be like, okay, maybe it's not quite what I feel like. Maybe it's not as bad. Maybe I don't need to do all these other things in order to feel okay. So those are a couple of techniques that are really helpful to address those preoccupations, negative thoughts. Mindfulness and attention training. So this is another way of working with thoughts. We can go into the content of the thought. People will laugh at me, right? We can look at that content of that thought and we can question it. But another way to deal with thoughts and negative thoughts and images is also to not give them as much attention and airtime. And sometimes that can be really powerful too. So mindfulness is a really great tool for training yourself to be able to shift your focus and attention away from maybe some ruminative, anxious thinking, repetitive thinking, and more to the present moment. And being more present often allows you to have more fun, allows you to see things more accurately, allows you to take in new information. So it's really kind of an amazing skill for helping a person kind of be more in the present, less caught up in some of these unhelpful thoughts. Attention training is something that's related to that. A lot of times when people have BDD, they're very focused on their flaws. They're focused on what do I look like, thinking about what other people think they look like. And attention training is all about shifting that focus elsewhere, right? Like focusing, instead of maybe focusing on how are people seeing me, focus on seeing the people around you, focus on taking in the environment around you. And shifting from that internal focus to an external focus, practicing that in different situations can be really powerful. So those are some of the techniques that are used in cognitive behavioral therapy. And then exposure and response prevention. So this is the big one. This is really the core of treatment for OCD, really important for anxiety disorders in general, and super powerful and important for treating body dysmorphic disorder as well. So exposure, much related to those behavioral experiments. It's going into those situations that you feel anxious, those situations that you avoid, approaching them with a plan, doing it a little bit differently, which gives you a chance to get more comfortable, build up your confidence, hopefully see that some of the things you feared didn't happen, or if something went wrong, that you were okay, you handled it. So exposure is about repeatedly just putting yourself in different situations that feel pretty scary. And that anxiety comes down over time. Response prevention or ritual prevention is geared towards trying to reduce those really repetitive behaviors. So, for example, somebody who might be checking in the mirror 40 times a day, you work with them to start to set goals about rules about when are times you can use the mirror and when are times you can't. Often people can't get straight to that end goal of, I only want to use the mirror and I'm brushing my teeth and checking to see if I have salad in my teeth during the day. Sometimes you can't get there immediately. So it might be, okay, let's see if we can cut down to checking the mirror, 5 times in the school day instead of 10. I kind of just gradually whittling that down till you don't feel like that strong urge, compulsion to do that behavior. And the same, we do the same types of things with anything, any kind of compulsive behavior, setting rules, reducing the amount of internet research, reducing the amount of time you might spend getting ready in the morning, number of times you change clothes, et cetera, et cetera. There's a whole gamut of things, but any repetitive behaviors, those are things we try to bring into check, which is really powerful because you see that you don't need those things. You don't feel like you have to do them, which is amazingly freeing. It's not so uncomfortable anymore. So that's the response prevention piece. And then the last thing that I wanted to talk a little bit about, this is unique to body dysmorphic disorder. It's a technique called mirror training. So in this particular tool and the CBT, for BDD toolbox, what you're working with people to do is to help them develop a little bit more comfort in front of the mirror and also an ability to see themselves in a more holistic way. So we talked earlier about how people often will focus in on specific flaws. Every time I get in front of a mirror, I'm always looking at this spot, right? I'm just staring at that spot. So now we're going to practice stepping back, seeing kind of the whole picture, seeing hair, face shape, got some eyebrows there, kind of nose generally, trying to see it all together, moving through each area kind of quickly. Without getting too locked into your feelings about liking or disliking any particular area. So that's something that a person would practice once or twice a day, a brief practice, really trying to cultivate this different way of looking at themselves. And the benefit there, hopefully this goes hand in hand with cutting back on the mirror checking. You're developing a healthier relationship with the mirror, not needing to check all the time, not staring at flaws, and being okay catching a glimpse of yourself, because for some people that can ruin your day. So getting to a place where you can see yourself and roll with it is an amazing thing when you have this particular condition. So those are some of the things that that I wanted to mention. I'll make a special note here as well of when we talk about response prevention. I wanted to make a special note here too of social media use, because this is a place where a lot of people often can spend a lot of time comparing themselves to other people. If you're really concerned about your body, you might be looking at all these fitness inspiration threads, and that can really, really, really feed into the BDD. So that's an important thing always for us to be thinking about, checking in with people and setting goals around having like more healthier use of social media. Okay, so I want to go through that. Okay, so now we talked a little bit more about the cognitive behavioral therapy and the ins and outs of that. And I wanted to give people some ideas if you do happen to have a loved one, a friend, family member who has BDD. I have some general suggestions about different ways to support them. So there's some wonderful resources. I'll give you some resources, some of these resources at the very end, but you can always direct them to these resources. You could direct them to this talk. There are a number of other talks that are online that are really great. And the International OCD Foundation actually has a whole page, a part of the website that's devoted to body dysmorphic disorder. And there's wonderful resources there, information about it, interviews with people who have BDD and with experts who talk a little bit about BDD. So there's a lot of great information out there to help people. Sometimes people will ask, like, oh, my friend keeps bringing up their parents all the time, or my son keeps asking me, how do I look? And what do I do? And so first, always first is listening, having empathy, caring. Of course, that always comes first. A lot of times people have the impulse to then like reassure, like, oh, you're okay, it's not so bad, or, oh, I have things that bother me too. And those things, they're well-intentioned and kind things to say, but often don't really help with the BDD because those beliefs are so strong. And often that need for reassurance, it just comes up again, the next day, the next day, the next day. Do I look okay? I don't look okay. The same conversation. So people ask, like, how do I handle these kinds of conversations? So you can listen, validate that they're struggling, but not get into either an argument about how they look or even reassure them about how they look. If they're seeking reassurance a lot, you might say, it doesn't really seem to help, I see you one way, you see yourself differently, and that's hard, right? And acknowledge that. But talking about it, the more time we spend talking about it, maybe that actually isn't helping. Maybe that's making it worse. Okay. Because again, feeding into that preoccupation, feeding in that time spent thinking about it, talking about it sometimes can do that. Okay. Related to this, limiting comments about your appearance or other people's appearance. I think that we have a very appearance-focused society with all advertising and media, and a lot of people are always talking about dieting, or eating healthier, or losing weight, or aging, all these sorts of things. So people talk about it a lot, and it does add to I think maybe our societal angst about these issues. But for people with BDD, it's another reminder of like, okay, this is really important. This is what you need to fix this, right? Like, this is what matters. It's just, again, feeding into that focus on it, feeding into that idea that it's so critical. So that's something where to have some mindfulness about it, about talking, if you're talking about your weight, or you're talking about your eating, or you're talking about how you look in a given day. Some of those little offhand comments or self-deprecating remarks, sometimes those can send a sort of a message. And oddly enough, sometimes the praise, you look great, you lost weight, those things can be triggering too. So something just to think about, it's not absolute right or wrong, but something to be mindful about. And as I mentioned before, the social media, you know, discouraging the parents focused social media. You could have a conversation like, oh, is that helping? Like, there's so many studies now showing how use of certain apps can increase girls' body image dissatisfaction and depression. We're learning more and more about this all the time. So those are good conversations to have, you know, and maybe help bring some mindfulness to that and how it might be factoring in. And another thing is to be mindful that cosmetic treatments don't help. Sometimes, you know, a family member wants to help by giving some money towards a cosmetic treatment or gift towards that. But just to be aware that there are some risks associated with it. And there can be, for a small number of people, it can make the BDD worse. And sometimes they can get quite worse from it. So being mindful, it's not going to fix the BDD. It might help to some degree with a particular concern, not going to help with BDD, and carries this additional risk of like a new preoccupation, right, and source of distress. So those are just some like general suggestions about ways to be supportive of people with BDD. You know, in terms of those resources that you can use, there's the IOCDF, International OCD Foundation, has that BDD website, and the address is here. The link is here. They have a Find a Therapist section, which helps link you with people who are trained in OCD treatment and BDD treatment. If you can't find someone in your area who specializes in BDD, but you can find someone who treats OCD using exposure and response prevention, often those individuals will have like the tools to work with you and have the knowledge and skill set. So that's a really amazing resource. In terms of books, there's also some wonderful books out there. Catherine Phillips, who's done a tremendous amount of great research of body dysmorphic disorder, has written a book called Understanding BDD, which has got some really rich, like clinical information, examples of people's life experiences with BDD. And I think a lot of times people really find that illuminating and validating to read about others' experiences. So that's a great resource. There are a couple of CBT workbooks that are really good. So Feeling Good About the Way You Look, a program for overcoming body image problems, is a CBT workbook for BDD. And there's also Overcoming BDD, a CBT approach to reclaiming your life. Both of those treatment programs are going to use some of those skills we talked about: exposure, ritual prevention, mirror retraining, mindfulness, cognitive restructuring, potentially. So it's going to help you build those skills. Those are great tools, and you're using them. If you're working with a therapist, you can bring, work on with those workbooks in your therapy as well. So that can be super helpful. So that's all that I had for today. If anyone had any questions, you can always reach out and contact me. You can actually find me through the ICDF website. I'm listed there. And I will put in into the talk as well, just put in my email address here. So if you had questions, you can always reach out to me as well. Not for clinical treatment per se, but if you're looking for help to get connected with a provider or some other question about BDD, you can certainly reach out. So, okay.